Hi, I'm Ms. V. Today we're going to be doing some Peri care for the CNA 2019 skills. The first thing you want to do is knock. Your patient acknowledges that you can come in. So I go in, I introduce myself and acknowledge my patient. Hi, Ms. Smith. My name is Valencia. I'll be your nurse aide today, and we'll be doing some Peri care, okay? She says okay and agrees to it, making sure I don't touch any of the patient's items until I wash my hands. So I'm going to give you some privacy, Ms. Smith, and go wash my hands and gather my supplies. So I wash my hands. For this skill, holding the linen away from you, you're going to need a bath blanket, six small towels, a bed protector, and you're going to need some soap. You can bring those things in the room. Put them on a table, which is the bedside table, which is considered clean. And I'm going to move your water and your phone, Ms. Smith. And I'm going to go get the water so we can start on your Peri care. So I go get my water, test it with my wrist or my elbow. Those are my sensitive parts. It feels fine to me. But it's not about me, it's about the patient. So I allow my patient to test it. She tests the water. She says it feels fine, so we're ready to do our skill. I'm going to go ahead and put my gloves on now. And I tell it for the students to make sure they don't forget to put gloves on once they put the bed protector. You can put the bed protector before you put the gloves on, but this just eliminates that. Let your patient know, Ms. Smith, I'm going to be lying you down flat so that we can get ready to do your Peri care, okay? Okay, I want to make sure that my patient is not laying on their gown. If they are, position the gown, get the gown away when you're doing it, because when you turn them to do Peri care and you do the back, if you don't have the gown is under them, you may have a problem. So I'm going to bring the gown up to her knees. I'm going to go ahead and place the bath blanket. Let my patient know, Ms. Smith, I'm going to just raise your gown just a little so I can get the bed protector under you. My bed protector. I can put it under. And then bring it all the way through. Get it under this leg. And make sure it is flat and not bunched up, because again, this will cause a problem when you get ready to turn your patient to clean them. Now, let Ms. Smith know I'm going to raise your gown up so I can get to your Peri area. So what I'm going to do is wet my towel, put some soap on it, lather it up. You need 3 different spots to clean, so position your towel. I do a tri-fold after I fold it in half. You start by wiping down from the distal down to the pad. I'm going to change sides. I'm going to go to the part proximal to me. Now, I'm going to go down the middle. This wet towel I'm going to hang on the side of my basin. Now I'm going to wet it. This is my rinsing towel. Again, in 3 sections. Wipe the crease down, that's distal, then the crease down, that's proximal. Now you want to go down the middle. Now I just want to take it, I want to dry her off. Making sure that you dry well. Here my dirty side. Now I'm going to take and put her gown down so that I can turn her. If you put the gown down over the bath blanket, it keeps them from being overexposed once you turn them. So I tell my patient that we're going to turn, and you take from the shoulder Put the knee up and you turn them towards the rail. Now, my patient's not overexposed from the front, and I can still see in the back where I need to clean. So I wet my towel, soap it. So you do the cheek that's above, wiping up, turn, do the cheek below. Now you want to do the middle because it's the dirtiest part. Now we want to rinse it. Rinse. Rinse. Here, side. Now we're just going to dry it off. Now I'm going to take my boot pad away. When you do, you roll it up to take it out, and once you use this hand, the only thing you can really pick up is your supplies. You can't touch the patient. But roll it up and contain all the dirty part on the inside. Guide your patient back over. And go ahead and take the bath blanket out. Gonna throw the linen protector in the trash. Okay, Miss Smith, let me get rid of my supplies and I'll be right back. So I separate them. Dry linen, wet linen. Dry linen container, wet linen container. Take my soap, put it in a designated dirty supply area. Now I'm going to take my water, dump it in the sink, rinse it out, dump that rinse, dry it out, put it back in its dirty designated supply area. Now I'm going to properly take off my gloves by pinching the inside and pulling, balling this one up in my hand, taking a finger and pulling this one off. Now before I go back and mess with my patient, I'm going to re-wash my hands. Now I can get my patient safe and comfortable. Okay, Miss Smith, we are all done with our Peri here. Let me know when you're in a comfortable position. She says she's comfortable, so we'll stop there. Okay, Miss Smith, here is your water and your phone. Get it up where you can get to it. And here's your call light on the bed rail. Is there anything else I can get you? My patient says she needs nothing else. I'll let her know to call me if she does. Under privacy, before I leave the room, I'll wash my hands again and my skill is complete.